Since digital front door is a bit of a buzzword, I wanted to explain that it really refers to the digital consumer experience that patients are seeking in order to connect in and find care and arrange for that care. So that can involve a variety of tools and mechanisms such as an online portal, a appointment scheduling app, a search engine, a physician matchmaking finder. So a variety of tools can be used. When you add other things in as available, such as chat or a little bit of augmented intelligence, you can really provide far more than an initial connection to your front door, but also help with patient education, compliance, and save money through efficiencies and processes. Let me give you a personal example. My sister just had her second knee replaced, and the first one didn't go so well. So she was entering into this with a lot of trepidation. After she used the digital front door, she was able to access her provider and arrange for her care. But beyond that, the benefits of that digital online experience got even better. She was able to connect in with her physicians on a regular basis. They were sending her chatbot messages before surgery, and they were giving her instructions that helped her understand what medications to take, what tests she needed, and when. And by the time she went into surgery, she was ready and feeling confident about it. After surgery, the messages continued, and that kind of trust and understanding of what she was going through really helped her be compliant with her care regimen and achieve really good outcomes. So I think as you look at digital solutions like that, realize they are scalable, they are efficient, they're helping save workforce time, and you're allowing for consistent messaging to really build and strengthen your brand and build these relationships with the populations that you serve.
At UNC Health, what we really found is over the last 2 years, COVID really changed the paradigm of that. So when you think about a digital front door, you've got your traditional web and mobile, but we really wanted to look at sort of focusing on the mobile side of it, especially. And so when we think of that, there's really two key aspects to that. One is the acquisition. How do we get people to download the app, come in through that front door? The other part is the utilization. So once people are in, how do you keep them there? IQVIA put out a report in July of 2021 that stated there were 350,000 health-related mobile apps. Out of those, 83% of them have been downloaded less than 5,000 times. 94% have been downloaded less than 50,000 times. So it's very clear it's a very competitive market, and that's just health related. That's not all the social media and all the other games and other apps that consumers compete on. So what we really looked at is how can we drive people to download the app and find value in it. And so the key thing we wanted is an app that had a universal platform. We didn't want a one-trick pony because it's so hard to get people to download an app. We didn't want them to have to try to download 5 of them. So we wanted to focus just on that one. What we've also seen, on average, people have about 40 apps on their phone. And out of those, only about 50% are actively used. So we really are trying to find not only how do we get you to download this app, but how do you find value in it? And how do you find other services that keep you coming back to it?
First one, I would say, PowerPoint is easy, right? It's easy to say that you can levitate and become invisible and all these things. So from the sales cycle, it's easy to say yes to everything. But in actuality, it is hard to deliver a mobile experience that people will actually engage with that takes all the disparate data sources that you have in your system and puts them in a usable form. That part's hard. That really flows into another point that I would make. Talk to your peers. Talk to your peers about what they've done, what they've used. We found in practice systems that have used a platform, especially ones that have a couple of years under their belt, are happy to share what worked, what didn't work, what they plan on trying, how the KPIs changed over time. Originally it's does anyone use it, right? So you're looking at the number of users, and afterwards it's how are they using it? Are they using it to do the things that we want them to do? So talk to your peers. You'll find them to be pretty open. Another thing that I would mention that's incredibly important is do not build a mobile app. And I know that sounds funny coming from someone who, by and large, produces mobile apps. But really, a mobile app, the day it goes live, is stale. What it really needs to be is a platform that can change and morph over time to meet the demands of the changing environment, that has a mobile app as part of the platform. But you don't want just the mobile app. With that, you are going to get stale almost instantly. The last thing I would say is that this is a platform that really interfaces to the real world and to people who are in real world environments. So to really understand how this looks and how this feels, you need to go and experience it yourself. So lean on your peer who has already implemented this platform, put this app in your hand, walk around with it, look at it from the point of view of a visitor, look at it from a staff member's point of view. What tools are used to manage the data and the features and the functions? Make sure that those make sense to you too and that you like it. So my advice there would be to go experience it in person to make sure it does what you want it to do.